Alright, let's talk about something you'll see every day in clinical practice: air in syringes. You've probably watched a doctor or nurse tap the syringe, push the plunger, and carefully squeeze out those tiny air bubbles before giving an injection. But why is that so important? What's the real danger behind accidentally injecting air into a vein? Here's the deal. Injecting air into the bloodstream is a big no-no. Even a small amount of air can have serious consequences, depending on where it goes and how much gets in. In the worst-case scenario, you're looking at an air embolism. That's when an air bubble travels through the veins, eventually reaching the heart or lungs, and blocks the flow of blood. If the bubble is large enough, it can stop blood from reaching vital organs. That means real risk of heart attack, stroke, or even death. Now, you might wonder, how much air does it take to cause this kind of damage? A tiny bubble, like the ones you sometimes see in a vaccine shot given into muscle, is usually harmless. But if you're injecting directly into a vein, the amount matters. Roughly 50 to 100 milliliters of air, if injected quickly, can be fatal. But don't get complacent. Even smaller amounts can cause symptoms like chest pain, shortness of breath, or confusion, especially in vulnerable patients. Let's break down why this happens. When air enters the veins, it travels to the heart. If too much air collects in the right side of the heart, it can block blood flow to the lungs. No blood to the lungs means no oxygen to the rest of the body. That's a medical emergency, and it's why doctors and nurses are trained to remove every last bubble. So, what should you do? Always check for air in the syringe before injecting. Tap out any bubbles, hold the syringe upright, and slowly push the plunger until you see a drop of liquid at the tip. It's a simple habit, but it's one that saves lives. Remember, as a future healthcare professional, your attention to these details makes all the difference. Stay sharp, stay safe, and never inject air.